Don't ever get masseter talks without considering these things first. The masseter muscle is a thick rectangular shaped muscle located on either side of the face, and it allows you to chew, bite down, and help stabilize the jaw. Botox, which I'll refer to as tox in the masseter, can have both an aesthetic and a medical benefit. With every single patient that comes into my chair, I make sure to walk them through the pros and the cons for this treatment so that they can weigh out the risks versus the benefits. So let's break those down here. Aesthetically, tox in the masseters can have a jawline slimming effect. The reason this happens is because after repeated injections, that muscle begins to atrophy and thin out, causing that slimming effect. But there's a downside to this, so let me explain. While jawline slimming sounds fantastic, by atrophying or thinning down this muscle, it could end up worsening the appearance of jowls. Now, what are jowls? As we age, we lose firmness and thickness in our tissue, and the underlying supportive structures begin to weaken. So we have this downward shift of tissue that collects in our lower jawline. Adding tox and thinning out this muscle can worsen the appearance of these. Just think about it. Prior to injecting, you had this thick, juicy muscle right here that was almost anchoring back skin. So as you atrophy that muscle with tox, that skin has nowhere to go but forward. So it can worsen the appearance of those jowls. Now in your 20s, this isn't a major concern because we still have this thick, healthy, dense tissue. But as you're approaching your 40s, this is definitely something to take into consideration. Now for my fellas, it's always important to consider that a more square shaped face is by definition more masculine. And if you atrophy those muscles down, it's going to give you a more feminine tapered appearance. So fellas always want to consider that jawline slimming from masseter tox can make you look more feminine. Now medically, the benefit of injecting tox in your masseter can really improve quality of life by improving those TMJ symptoms of clenching, grinding, and headaches that you get from it. By weakening that muscle, it reduces its ability to bite down and can dramatically improve these symptoms. So for my ladies, worsening of the jowls, and my fellas, possibly feminizing the face, these two things should be taken into consideration aesthetically when receiving masseter injections. Why do I say no to this treatment often? When deciding whether this is a treatment for you, this requires a thorough consultation. For my patients that are more focused on the aesthetic benefit, I discussed the possibility of worsening the jowls. Now, if this isn't a major concern, then we proceed with a little bit of tox injections in the masseters. Now, for my patients that are more focused on that medical benefit, that quality of life improvement of clenching and grinding, I always discuss the downside aesthetically, and if they're okay with that, then we proceed with tox injections. Now, with all of that being said, I get masseter tox for my masseters. I have thick hypertrophied masseters, and it really improves my clenching and my grinding. I've been doing it for years, but I understand the downside of possibly worsening my jowls, but it's worth it for the medical benefit for me. So always weigh out those risks versus benefits to determine if this is the treatment for you.